When it comes to preparing for the birth of your child, having a birth plan in place can help ensure that your wishes are known and respected during labor and delivery. A birth plan is a written document that outlines your preferences for how you would like your labor and delivery to go. It can cover a wide range of topics, from pain management options to who you want in the room with you during labor. One of the first things to consider when creating your birth plan is where you would like to give birth. Some women choose to give birth in a hospital, while others prefer a birthing center or even a home birth. Each option has its own set of benefits and risks, so it's important to do your research and choose the option that feels right for you. Next, you'll want to think about your preferences for pain management during labor. Some women choose to use natural pain relief methods, such as breathing techniques and massage, while others opt for medical interventions like epidurals or nitrous oxide. It's important to discuss your options with your healthcare provider and decide what will work best for you. You'll also want to consider who you want to have with you during labor and delivery. Some women prefer to have their partner by their side, while others may want a doula or other support person present. It's important to communicate your wishes to your support team so that everyone is on the same page. Another important aspect of your birth plan is your preferences for monitoring during labor. Some women prefer intermittent monitoring, while others may opt for continuous monitoring. It's important to discuss the pros and cons of each option with your healthcare provider and make an informed decision. You'll also want to think about your preferences for interventions during labor and delivery. This can include things like induction of labor, episiotomy, and assisted delivery methods like forceps or vacuum extraction. It's important to discuss these options with your healthcare provider and decide what you are comfortable with. Finally, you'll want to think about your preferences for the immediate postpartum period. This can include things like delayed cord clamping, skin-to-skin contact with your baby, and breastfeeding preferences. It's important to communicate your wishes to your healthcare provider and make sure that everyone is on the same page. Creating a birth plan can help you feel more prepared and empowered as you approach labor and delivery. It's important to remember that birth is a unique and unpredictable experience, and it's okay if things don't go exactly according to plan. The most important thing is that you and your baby are safe and healthy. So take the time to think about your preferences and communicate them with your healthcare provider, and trust that you are making the best decisions for you and your baby.